Communication. Communication is the process of exchanging information between individuals or groups of people. It's important to remember that today's older adults formed their opinions, their values, and their beliefs in a very different society than what we experience today. So good communication can bridge that gap created by different societies and generations, along with a need or desire to share information. We need to accept the value or merit in what another person has to say and be willing to treat that other person with dignity and respect. We also need to understand potential barriers to communication. And development of skills and techniques to facilitate effective interchange of information is necessary. Information sharing involves sending and receiving messages by means of words. It can be formal with structured and precise language with a specific intent and purpose, or it can be informal with unstructured and flexible, less specific means, and it's used more for socialization. Therapeutic communication is that conscious and deliberate process that's used to gather information related to a client's overall health status and to respond with verbal and nonverbal approaches. It promotes the client's well-being or improves the client's understanding of ongoing care. With social communication, we often see small talk, pleasantries, and conversations about the weather or a favorite television show or the latest news. It can demonstrate that the nurse thinks of the client as a real person and not just as a patient. Don't be afraid to be human when you're communicating with older adults, and remember that it's okay to laugh at yourself, but never laugh at another person. We use symbols. For example, uniform styles and colors can help clients distinguish the various caregivers. A lack of uniform can be very confusing for older adults. The white uniform and cap that nurses used to wear were symbols of a certain level of education. The tone of voice is usually a reliable way to judge emotion. But some people shout when dealing with someone that's hard of hearing, and that can change that tone of voice. The shouting is frequently associated with anger or displeasure, and it's not appropriate when we deal with those people that are hard of hearing. A better option would be a low tone of voice close to the ear. Body language is communication by moving, standing, sitting, and positioning. If the words and body language don't match, body language usually speaks louder. Nurses have to consider their own body language and watch for the messages that clients are communicating to us through their body language. Space, distancing, and position. The amount of space between two people is significant. Too far away may communicate indifference, and too close, too soon, can be very offensive. With gestures, specific types of nonverbal communication are used to convey ideas. These gestures can be highly cultural and generational. Those that are acceptable in one culture may be considered offensive in another. It is important to verify that both parties know what the gestures mean. It is helpful for clients that cannot use words. And aphasia is difficulty finding words to express wants, needs, and feelings. To prevent cultural bias in caregiving, it's important to recognize cultural biases in yourself and in other people, and provide skilled interpreters, visual aids, etc. for multiple language groups. Address complaints about cultural misunderstandings to help provide culturally sensitive care. Our facial expressions communicate across cultural and age barriers. Fear, anger, joy, and a variety of other emotions can be conveyed by a simple change in facial expression. It's really important to be sensitive to the meaning of eye contact. It's often interpreted to be a sign of attentiveness and acceptance, but in some cultures, averting the eyes is a sign of respect. Face-to-face contact also maximizes the chance that an older adult with hearing problems can read lips if necessary. The pace or speed of communication can be very important. Nurses tend to be substantially younger than the aging clients they serve, so the resulting difference in the rate of speech and movement can be overwhelming and frustrating to older adults. It's important to wait for the older adult to organize his or her thoughts. Patience and active listening are key. Time and timing. Delays in response to a call-out or direct request from a person can be interpreted as a lack of concern, even though that's not what the intention is. Response to this perception may manifest in anger, displeasure, anxiety, fear, and many other feelings. Many older individuals have an altered sense of time, and information given too late or too early can lead to confusion. With touch, no words are required. There's no need for a high-level sensory or cognitive function. A caring touch is a basic need of all humans. Many older adults suffer from touch deprivation, but use caution if a client is in pain. Observe how the client responds if there's doubt whether he wants to be touched. Sometimes being silent can be very difficult. Words can be intrusive or distracting. Silence can be therapeutic because sometimes that simple presence can be more helpful than verbalization. Listening. Empathy is a willingness to attempt to understand the unique world of another person. Empathetic listening is actively trying to understand the other person, not just knowing many facts about them. Be sensitive to the strengths and limitations of older adults and focus on the person, not just on the task. Effective communication starts with proper introductions. Nurses should determine how each older adult wishes to be addressed. And it's better to start by using the older adult's proper title and name, such as Mrs. Quinn or Dr. Jones, and then clarify which form of address the person prefers. Avoid elder speak, which is patronizing and a demeaning way of speaking to older adults. So don't call them names like sweetie or honey, or don't speak to them as if they were a child. They are adults. So question, when you walk into your client's room, she's crying. The best therapeutic response would be, C, you seem upset. Tell me what's going on. Barriers to communication include physical problems, pain or extreme fatigue, disease processes, diverse social and cultural backgrounds, hearing impairment. So if they have hearing aids, make sure they're clean, that the batteries are working and they're correctly placed. Minimize background noise. Stand at eye level in front of a person and keep your mouth clearly visible. Talk slowly and at a lower pitch. Use visual cues and avoid exaggerated mouth motions. Aphasia might be another barrier, which is that partial or total loss of ability to use or understand words. It affects the ability to understand and express oneself through words, gestures, and writing, but it does not necessarily affect their intellectual functioning. So keep those messages simple. Use visual aids. And singing is a potential option for communicating with a client that has aphasia because singing and speaking use different areas of the brain. Singing therapy is coming into use for clients that have aphasia. Another barrier is dementia because it causes both cognitive and language deficits. The level of function will vary based on severity. Characteristics will include a limited attention span, an inability to focus on more than one thought at a time, confusion of fact and fantasy, and an inability to follow complex instruction. Strategies recommended when communicating with a client that has dementia include talking about one thing at a time, limit their choices, keep conversation in the present, using yes and no questions, offering choices to finish a thought, avoiding questions that require recall, using gestures to demonstrate an action, avoiding intercoms, avoid arguing, redirect the client to appropriate activities, sharing activities. Remember, don't try too hard and be careful of the tone of your voice. Different skills and techniques of communication involve informing, which uses direct statements regarding facts. A good information statement will be clear, concise, and expressed in words that the client can understand. It's the least effective form of communication because the client is not actively involved. Direct questioning. Too many questions can overwhelm a client. It may block rather than expand communication. It can be helpful to obtain specific information or in emergency situations, but it tends to yield brief answers, often only a yes or a no. Open-ended communication techniques include open-ended questions, reflective statements, clarifying statements, paraphrasing. These allow the client more leeway to respond and establishes a more empathetic climate. It allows also for verification of accuracy. Confrontation is used when there are inconsistencies in information or when verbal or nonverbal messages appear contradictory. It is one of the most difficult communication techniques to use and should be used only after a good rapport has been established. It is never advisable to confront a highly agitated or confused person. When communicating with visitors and family, interaction with a client's family and friends are critical. They're a source of support for the client and information for the nurse, and they can also help interpret behaviors that the nurse might not notice. If we have to deliver bad news, prepare yourself first. Think through what you want to say and establish an environment that respects the client's privacy. Determine whether anyone else needs to be present. Make sure there's adequate time free from interruptions. Determine what the client already knows and recognize that ethical and cultural variations may influence the way information is delivered. Use simple and direct but sensitive language to begin this message, such as, "I'm afraid I have bad news for you." Respond to the person's emotional reaction. Do you want to talk about how you're feeling? Develop a plan for follow-up. And communicate significant information to other caregivers as a part of a plan of care. And having those difficult conversations. Pick a place that's private and at a time that you're going to be free from distractions. Try to focus on a single topic and don't bring up old grievances. If a conversation is not going well, consider your own feelings and motivations. Express your feelings using I statements rather than you statements. Respect the right of the other person to agree or disagree. Keep a balance between talking and listening. And view each communication as a new opportunity to learn something about the other person. Don't prejudge. Be aware of your own feelings regarding the issue under discussion. Avoid blame. Learn from both negative and positive interactions, and try to achieve that win-win situation. So to improve communication between the older adult and the primary caregiver, suggest that the client keeps a list of concerns and questions. Ask the primary care provider to repeat and summarize directions. Identify printed materials that support the provider's recommendations. Suggest that a friend or a family member might be present to take notes and help the older adult express concerns. And act as a client advocate. Improving communication with the healthcare team, start by identifying who you are. In other words, what's your name and your title, the client or clients you're calling about, and the specific reason for that contact. Plan ahead and have a focus for the communication. Know what you want to report or find out, and be organized, clear, precise, and complete. When you telephone primary care providers, use like the S bar or the IS bar R with the introduction, situation, background, assessment, recommendation, and read back. Plan ahead and have all relevant information ready. And with client teaching, remember that adult learners are oriented towards problem solving. They view learning as most desirable when it's going to be relevant to their own lives. Start with what the client thinks is most important. Pick the right place and time for teaching. Realize that modifications might be needed to compensate for common sensory changes that are experienced with aging. Times that should be avoided when selecting a teaching time is when the client is stressed, fatigued, in pain, or distracted by something of higher priority to them. One more question. In an emergency situation, when information must be obtained quickly, the best communication technique is direct questioning.